Don't worry.
Doctor?
So you are mute as well, huh?
Oh.
Yeah. We can go to the presenter view now, and we can start. I guess people will join.
Yes, yes. Participants मी बघतो.
Perfect. We've reached 88. We should start, I think, Sudhi.
Yeah.
Okay.
91.
Preeti.
Hi, good evening. I guess last few months have been really trying for all of us as we are confined to our homes and most of the time. And some of us are learning and relearning about our passion and hobbies. For most of us, running is our passion. So Pune Running thought that this would be a good time to review, assess, and improve upon running. And therefore, we decided to conduct few sessions on various aspects of running. Today, we have chosen to discuss about importance of running gait analysis. And there's no better person than Dr. Mapari who comes to our mind to this. I guess whenever we have injuries or aches or pains, anyway, his name always comes up, on the top of the chat or, on any conversation that we have amongst runners. So Dr. Ajit Mapari has been working as a sports and medicine consultant in Pune. He has 20 years of experience in the field of sports medicine. He has completed his master's in sports and exercise medicine from University of Exeter in UK. He also comes with a very rich and vast experience in the field of sports. He has worked as a team doctor for FC Pune City, representing Indian Sports League since 2014. As a medical team head for Indian tennis team at the Davis Cup against New Zealand. He was also appointed as a team doctor for Dabang Delhi Kabaddi Club. He covered the first Indian badminton doctor. He was assigned through the ICC as an International Cricket Council as a DCO or a chairperson or a chaperone for India-Australia ODI series and West Indies Test series. His work includes injury prevention and management, sport-specific fitness guidance, and program execution, covering events as a sports doctor. He is a director for Integrated Sports Science Research Association and International Rollball Federation. As a founder of Fit to Sport, he and the team works in the field to better the future of sports-specific fitness and performance enhancement. Fit to Sport has been associated, as you all know, has been associated with Pune Running on various endeavors, including the PRBM 2018, where they ran a recovery center for almost 15,000 participants. Today, Dr. Mapari with us, and I'm sure his guidance on importance of gait analysis will be very valuable to us. Over to you, Dr. Mapari.
Hello, good evening, everyone, and thank you for such an elaborate kind of an introduction. But firstly, I would like to thank Pune Running, the whole group, the management of Pune Running. Sandeep Kolatkar, Sudhi, and Preeti obviously are here, and I guess a few more people. So thank you, Pune Running, for not only starting up with this kind of a series of talks and discussions in this crisis, but also it is very important to highlight certain aspects of running that mostly most of the runners are not very much aware of. So I'm happy to kind of start off with something which has come to my mind more than often than not, because this particular running gait analysis has been on top of my mind since I've been seeing a lot of runners at Fit to Sport. As most of you all know that we cater to a lot of running injuries at Fit to Sport. My team is obviously there, not only managing events like PRBM, but also we see a lot of runners from novice recreational runners to ultra marathoners and comrade runners. So let us begin with something, as I said, importance of gait analysis, and let me just kind of focus on what is it. So first thing, let me make it very clear to all of you is I'm not going to make it very technical, because this is a very technical topic if you start to go into the depth of it. But I'm going to make it very simple, simple to understand in the sense what is this gait analysis is all about. So first, let us understand quickly what running gait is. As you all know, let me just come down to one particular point. One's ability to walk does not necessarily mean that they have the ability to run. Okay, so this is a very tricky thing which I'm speaking right now. Why I'm saying this is because running requires more balance, running requires a little bit of muscle strength, and running requires more endurance, unlike walking. And obviously, walking gait is a complete different phenomena, and we completely look at it from a very different scientific perspectives than running. So as far as running gait just to kind of sum up, I'm going to split it into two phases. One is the stance phase and one is the swing phase. So what happens is when a complete gait cycle, it begins when one foot makes contact with the ground and ends with the same foot making the contact, making the contact on the ground again. So in this particular phase, as the definition itself suggests, that it's a cycle where one is the stance phase where one foot is touching on the ground, and the swing phase is when the same foot isn't touching the ground. So when you come to this particular running gait, let me tell you technically, there are too many factors that you can actually observe when it comes to running. Now, by observation only does not mean that you can entirely sum up what the running gait is. Now, what happens is, even if you see in this particular video where this particular runner is kind of running, so what happens when you run on the road with your group, with your coaches, with your trainers, with your colleagues, with your fellow runners, you tend to, either if you're a novice, you tend to get a lot of feedback and guidance from your fellow runners, okay? And for me, technically, it is very difficult to comment every single time on the gait unless we don't analyze it properly. So, no, of course, I mean, as I said, your colleagues and trainers and coaches and fellow runners, and you're somebody who's an experienced runner, obviously not all suggestions are wrong, but when it comes to actual commenting on gait analysis, we have to, on your running gait, you have to actually analyze it properly. And how we can analyze it? Obviously, one is visually, which is kind of a little difficult, but if you use some science and technology, that helps immensely. Now, what happens is, there is a lot of research that goes into, running and getting the running gait analyzed. People all over the world, especially in some of the major universities like University of Wisconsin, which is doing a huge work in terms of running gait analysis, what these people do is they have gathered ample amount of data to come down to some conclusions, that this is how a runner should actually have certain parameters in place. So what happens is, why we getting into this, as I said, is injuries are very common in long distance runners, be it recreational runners or be it somebody who's just taking up about 5K runs and they want to progress it to 10K. And similarly, people keep on going from one benchmark to the other, and they want to kind of compete with themselves, which I may put it right. So what happens in this whole process is getting some injuries here and there is very common, like especially the lower leg injuries, which, as I said, majority of the runners that we see, and even all over the world, you see that they have lower limb injuries. Now, why do we do this running analysis? It is very important to understand that long distance runners, as I said, are very much prone to some or the other injuries. Okay, and some injuries are repetitive. Like I have seen so many runners who come back when they start to increase their mileages, when they have certain goals to achieve and there is something that goes wrong, they might come back with some injuries which probably are either repetitive or some new injuries. So if at all we want to talk about why you need to do a gait analysis, obviously it is because these injuries can be kind of understood why it is happening. So secondly is there are some people who want to increase their efficiency. Not necessarily all runners are injured or they have injuries. Some niggles here and there obviously are common, but they can get away with it. But some want to improve their efficiency. Efficiency in the sense, it just suggests that, you want to increase your timing for that matter. So obviously without getting injured, you want to increase your timing. So you need to understand how your running gait is. There are people who are coming back from some major injuries and they want to kind of get back again to running. And slowly once they get back, they still want to ensure that, we don't have that same injury again, or we don't land up with certain injuries again. Lastly, is there are few runners who absolutely are, they've been running all throughout very systematically for following a good training program, and they just wish to know or rather understand the biomechanics of their running gait. So there are a lot of things that we can get into, but the major thing which I want to kind of suggest is you have to understand the advantages of doing a running gait analysis, because you can identify the reasons behind your injuries, and the biomechanical analysis obviously helps you to correct those. So it could be muscle imbalances, it could be any tightnesses in some muscle groups, it could be problem with the range of certain muscle, ranges of certain joints. It could be training, the gait pattern that you're following, the running pattern you're following, that could be something that needs to be corrected. And obviously the aim is to improve the efficiency of your run. Now, before we move on to kind of understanding how we need to do this particular running gait, or what is done, how do we analyze the gait, it is also important to understand that, as I said in the previous couple of few minutes ago, that there are certain elements that you tend to either follow if you are a runner who probably are following, like, if you're trying to copy somebody else's run, or rather take advantage or take advices from people who are experienced as such, but the pattern definitely shouldn't, it is very difficult to copy somebody's running pattern. There are certain principles that you need to follow when you want to kind of take up a proper biomechanical running gait. So you need to understand that just by following somebody's pattern or doing some overcorrections, or rather changing some footwear, or there are too many factors, as I said, and people keep doing it. I mean, I see most of the runners who come to me that they have been doing following certain advices from their fellow runners or coaches or trainers. As I said, not all are wrong, but yes, you need to understand that in spite of that, if you're having some problems, you need to kind of seek guidance in terms of what is going wrong, and that cannot happen by just visually or just by observing. Some major flaws which are there can definitely be rectified, but when it comes to actually finding the intricacies of running gait, you need to understand that proper analysis needs to be done. Now let us see how it is done. Now if you see that it involves technology. Now once I said technology, that means there are certain aspects which we look at. First, when the runner comes to us, we kind of take relevant history. There is some marker placements, a proper warm-up session is done. Then we make them run on the treadmill, and simultaneously we record. Now I'll tell you, because we're talking about running gait analysis, I'm going to slightly go more into a little depth of how actually it is done. Now this whole process of running gait analysis involves these three main components. First is the history and physical examination. Obviously, we need to understand what injuries the runner is undergoing, or rather having currently. What are the training habits, like how many days of the week the runner is running, what is the mileage that looks like, any running related goals the runner is having in his mind. identify any physical impairment. So we clinically evaluate as well in terms of certain joint range, which are be it hip or knee or ankle. Then we kind of come down to some history taking where we understand that this is the pace of that particular runner actually on clinically. Then we come to the running gait analysis. Now, how do we do that? We characterize the running mechanics. Then, depending on, basically it's a process, and I'm going to explain it to you how we do this. So there is something that we derive out of this particular activity, that we see the landing posture, we see the tissue loading profiling, and we also check the angles, different angles at different phases of running. The ones which I was talking about in my first few slides is how these stance, running stance, and the swing phase and the stance phase are. So in these particular phases, we tend to measure certain angles. And lastly is about the footwear assessment or orthosis. Basically, there are a few runners who are into barefoot running. Some use minimalistic footwear. Some people are doing proper running footwear. Some people have customized insoles because that is what is been advised to them. So there are certain elements that we need to look at in terms of whether these particular footwear are changing any mechanics of running, or whether the barefoot running which the person is into already, is it right for that particular person to run barefoot? So these are the elements that we find out, and this whole process is all about getting the analysis done. Now, let me come to this marker placement. So what is this marker placement? So once the runner's history, everything is taken, clinical examination is done, we place some markers, or rather, we mark certain points, anatomical landmarks, which are demarcated as per the protocols that have been designed, as I said, by a lot of research that comes up. So the one which we currently are using is probably one of the best researches that has been done in the world today by University of Wisconsin, and they have formulated certain protocols of analysis. And there is also the software and the hardware that we're using is of gait, which obviously is one of the premier company right now who's dealing with running gait analysis along with other biomechanical analysis as well. So these marker placements are on particular landmarks that should be visible throughout the whole process. So there are certain flat markers, there are certain ball markers. So we keep on applying these markers at those designated places before we make the runner run onto the treadmill. Now, once the runner is ready, we make them warm up the routine one, and then we start making him run on a treadmill. Now there are 4 cameras which are placed on either side, like front and back, and both the sides, right and left, and the whole process of running is recorded. Now, this recording, obviously, there is some reason why I'm going to kind of tell you that why treadmill. Now, there are certain people who might ask me, why treadmill? Because we run on the road. So what has research shown? That once you run on a treadmill for 6 minutes, you get to your normal running rhythm, and that rhythm is obviously as normal as what you run on the road. So this has been proven by research and lot of data. So even if you feel that treadmill running is different than the road running, but you have to consider this factor that it has been researched well. And post 6 minutes, we start to kind of, once they get into the running rhythm, then we start to identify and rectify and start recording the particular run. So as I said, we start from each side, maybe right side, the left side, and the front side. You've already seen the back side. So what this gives us an idea of the particular run. Now what these markers do, okay? Now these markers obviously are only to record. Now as I said, we need these cameras which are placed on all sides. What these cameras do, they capture images at a very high frames per second, So they have this kind of a capacity of making, or rather you can freeze these particular images or other videos at the exact position where we want them to freeze. So that's why these cameras has to have a high frames per second capacity. We cannot have it by doing we cannot record this by our mobile phones or by using our webcams and things like that, because they have a very slow frames per second rate. So once we record all these things, then obviously we, as I said, these markers are meant only to identify, rather mark these points when we start to put them on in a software. Now, report analysis, as I said, this is a sample report which you can see on your screen, which is there. So these, mainly it is more of a clinical acumen. You cannot just have a runner run on a treadmill and then you get a printed report and then you just, this is not something that is there. There's a lot of thinking that goes behind actually doing, a lot of clinical stuff that goes into understanding what we need to identify. So as I said, using software and required, various angles are kind of noted. These are noted at different phases. Now, if you see, there are lateral views, there is posterior view, and there is anterior view, like is it from the front, from the behind, and from both the sides. And plus there are, as I said, it could be your initial contact, mid stance, push off. So these are the phases of running. As I said, because I don't want to go into more technicalities, as I said, but if you understand, let me just talk about one instance. If you say initial contact, what is initial contact? Is when one foot just about barely touches onto the treadmill when you run. So that is the initial contact of that particular foot, or rather right foot. So what we do is we freeze that particular image at that particular point. So we have to go too much of back and forth to understand exactly where that initial contact is. And from there, we we freeze that image and we can start calculating the angles. So it could be the initial contact, and there is something called as mid stance, when it's a different entity altogether, and push off, obviously, as the name suggests, when the foot is pushing off the treadmill or rather run, and when you so this is how there are different phases that we look into, and then we analyze. So these particular analysis, or rather reference values that you can see onto the report, are all evidence based. They're based on evidence. So whatever research has been done, as I said previously, there are things that are completely derived from those evidence-based models, and we start rectifying, or rather understanding them first, and then those variations are studied and we establish them with clinically. So as I said, when we see you clinically at the onset, before we start doing the analysis, or rather before you start doing the runs, it is very important to understand clinically whether the joint is stiff, whether the muscle is tight, whether your ranges are proper. So those things obviously are related with whatever data that is generated through this particular report. Now, what happens is this doesn't end here. I mean, actually, the gait analysis for everyone is done. Now, this is what the gait analysis is all about. This is the process of analyzing a proper gait, running gait. And what we identify, as I said, is the biomechanical misalignments that you see, the muscle tightnesses that you see, and the relation that these two establish to identify what could be the problem leading to that injury. So we start working on that. So it could be repetitive injuries happening because of certain angles, or rather having some runner are prone to injuries. Maybe they're not having any injuries right now, but because of certain element in the biomechanics, they might land up with certain injuries. So this is a very good tool to understand the prevention part of it. So gait analysis also help you to prevent certain injuries if you start rectifying it. Now it's a whole process, as I said, and this particular thing sums up the whole running gait analysis. So I guess I've made most of the points clear in terms of how it is done and what the process is. I think it is better for most of you who are into serious running, who want to kind of get your mileages better, who want to become injury free and run. It is always better to get your running gait analyzed. Thank you so much. Thank you. I'll definitely, it's open for questions. So I think Sudhi can come in and he can definitely take some questions if they are there. For any other details, if you want to, you can just shoot your questions by emails to me on the given ID. You can call up on the clinic number and we can definitely take it from there. But right now, as I said, I'm absolutely open to any questions. If we have, yeah, we have some time at hand, and we can definitely take it up. Yes, Sudhi.
Yeah, thanks, doctor. That was just wonderful. So what I'm going to do now is I'll unmute people, okay, and they can ask questions. So is that okay, doctor, or do you want them to text on the chat? What
I'm
would you
okay
prefer?
with whatever. If somebody wants to ask directly, they can ask me. But then, if you unmute everyone, I guess somebody needs to raise hand or something, and then you can unmute them, or they
Yeah.
can or chat box. Anything is fine, unless it is smoother. I have no problems.
Okay. Yeah. So people, what you can do is, yeah, Sheetal. So doctor, if you see on the chat box, Sheetal has a,
I'm just
yeah,
just
Sheetal has a question.
Yeah, so Sheetal wants to know her left medial meniscus leg pain, what exercise to be done. See, let me just request everyone that let us kind of frame our questions regarding the gait analysis rather than talking about injuries for now. But yes, injuries related to gait analysis can definitely uh, be of, definitely I can help you out with that. Obviously, I mean, I would love to answer all the queries, but something related to exercises for aches and pains right now is not the right topic currently. So I'll request everyone to kind of just stick to the gait analysis part of it. But yes, exercises doing, Sheetal, if I want to kind of answer quickly is, it is very difficult to comment without examining where the left medial meniscus is and whether it was operated, not operated. A lot of questions will come to my mind. So I think we'll just skip this question. I'm sorry for now, but you can contact me directly if whenever the time permits. Okay. Sorry. Yeah, Sudhi.
Yeah, doctor, there's one question from Pooja Gavas.
Yeah.
Okay, she asks, how long does this assessment or analysis take? And also, how does it take to incorporate, how long does it take to incorporate into your running for better results?
Yeah. Good evening, Pooja. I think no, this whole process of doing the running gait analysis takes about an hour from the point the person walks into the clinic. We kind of take the history, everything, and then we put them on to this process which I explained. So it takes about an hour for recording, and then it takes about a day. We obviously call them again for review to explain them the report, and depending on the report, then there are too many things that can be lined up, so basically what we usually do is once we identify the problems, we start to we have a plan in place. So it could be related to giving them corrective exercises to do at home. We obviously start correcting their muscle imbalances, if any. If there are any biomechanical corrections that needs to be done, we start doing them partly in the clinic, and partly we tell them to do as homework. If you talk about incorporating this particular whole program into your regular running training program, what usually the research say is it takes about 6 to 8 weeks for you to get back to doing what the corrections have been done. So basically, once we do the corrections, and there are certain gait retraining methods that we have to follow. There are certain so these gait retraining methods are again scientific and based on a lot of research. So we make them run on the treadmill in the clinic and train them how to retrain their gait, and then they have to follow the similar pattern on the road when they run. Then we do follow-ups and things like that. So to kind of understand how better you are post your analysis, you should kind of consider about 6 to 8 weeks. So it does help.
Okay, thanks, doctor. Doctor, there's one recurring theme about gait analysis, which is how frequently should this be done? And should it be done before injury, after injury, or if you're not injured, then should you be doing it? Can you just throw some light on that?
Correct. So basically, this is a very good question. Let me just put it in with, this is not to be done very frequently, as I said. Once you do your gait analysis and understand what the problem is, then it becomes easier to plan the further program based on the problems that we find, and then we can decide. So usually what we do, if there are major flaws that we see in the running pattern, uh, or we know that the person is getting re-injured every single time because of certain element, then once we do the corrections, probably post 8 weeks to 10 weeks, or maybe after say 2 months, we kind of do one more analysis only if it is required. But otherwise, once you get into the whole system of running properly, then it only boils down to when you increase the mileages, when you want to set different goals, then you can come back and start doing it. But mostly once you start becoming symptom free, you automatically come to know that you're doing better. So there's no point in analyzing it every now and then.
So, Doctor, Rahul K is asking, should one do gait analysis if one is aiming for HM or FM? So, should it be before starting the training, or once you are deep into the training and you're doing the long runs?
No, definitely it has to be before you get into. See, this is the right time now because of this unfortunate COVID situations. Most of the people have gone into their own shells. They cannot possibly do the runs that they used to do before the lockdowns happened. So now that you want to get into full-fledged running, you should get your run analyzed. Depending on what symptoms, what you should understand why you want to get it done. Either you want to increase your efficiency, you want to get rid of your aches and pains, you want to kind of avoid certain injuries. So these are the major things that you need to look at. And then once you have these particular things on mind, you can definitely get it done during the training phase, not as close, because you're closing down to doing an event of half marathon or full marathon. You have to understand you need to do it better early than late.
Okay. And then Mahesh asks, he feels his one leg is weaker than the other. Now, is this about gait? Is it about balance? Is it about muscle strength? Or my question is it something that you can answer here, or you'll need to check?
Yeah, basically the last part obviously is right, because I'll have to check first. But yes, there could be multiple reasons. You could be related to weaknesses. It could be muscle imbalances, as I said, and gait, because you start to compensate and use one leg more than the other leg because you're compensating. You can just drag on, continue doing with the same kind of a thing, and it becomes really difficult. So I think it is more proper to do a complete analysis from examination to analysis to identify the problem.
Okay. And Ashok is asking how to get rid of frequent left calf muscle pain or sprain.
Correct. So again,
gait analysis and then subsequent exercises help with that?
Yeah, basically, as I said, if it is happening repeatedly, there has to be some reason to it. And you need to identify that reason why it is happening every time. If it is only the left calf that is getting into problem, then maybe there is some definitive reason why it is happening, and you need it to identify. For identification, not necessarily you have to do a gait analysis only. Clinical evaluation and proper history taking, or maybe just checking the whole kinetic chain might give us some answers. But if it doesn't stop there, then obviously gait analysis is the next thing that we can do. So not every time you have to jump to doing a gait analysis. You can do some bit clinically and then shift to gait analysis as well.
Okay, thanks doctor. There's an interesting question from Mahesh Kumar. I don't even know if this is related to running. Looks like he wants to get into the army, and his question is, rather his problem is that he has knock knees and flat foot. So is there anything that can be done about it?
Again, both ways. Flat feet can be identified by doing some insoles customized insoles that we do. But unfortunately, to my knowledge, when you want to get into any of the armed forces, even with customized insoles, the flat people who have absolutely grade 3 flat feet, they usually don't entertain those people for some reason, because they know that they can land up with certain stress problems when they get into their aggressive training modes. So as I said, I don't know what grade of flat feet he has and how much is the knock knees he has. So clinical evaluation again is going to give me more diagnosis.
Okay, okay, that makes sense. And we keep, this is from NDK. He says, we keep hearing about midfoot landing to avoid injuries. How? Yes, there is no universal running form, but how important is this midfoot landing, doctor?
See, as I said, there are certain patterns that we need to understand, So midfoot landing, again, as I said, before going into more of the technical stuff, we need to understand that there are theories that kind of supports some particular running pattern, and there are theories supporting some other pattern. So what usually gait analysis does is, for that particular runner, if the midfoot landing into particular stance is giving problems to some other, changing angles at certain other, maybe hip or even the shoulder for that matter, or hip hiking, or how much bounding it is happening. So that is more relevant rather than having a midfoot landing or a forefoot landing or heel strike. So this is very relative. We need to understand for that particular runner, as I said, what is right for him or her.
So what you're saying is that just thinking that midfoot landing will solve all my problems is not right. There are many other dimensions to it.
Very much true.
Okay. And yeah, good question, Aniruddha. So would gait analysis be relevant to beginners who have just started running?
Correct. It is definitely better for beginners, is because you can rectify your problems right from the start. You can get into your proper running pattern. You can, as we identify your problems, you can get the corrected running pattern or retraining done before you increase your mileages. So it becomes very, very convenient and easy and injury free, or rather you cannot call it injury free technically, but yes, risk of injuries definitely will go down if the runner is in novice.
So what you're saying is that before the beginner gets into bad habits, if he or she can get gait analysis done, then corrections can happen. Is that right?
I don't want to use bad habits, but what happens usually is, you've been running, Sudhi, for a while now, and you know
Yes.
how important it is to understand that once you start going from 5 to 10K, usually you don't land up in any problems. When it starts to going to 15K, somehow with some niggles you can go get away with it. But as you start to go towards your HM, then you, especially with people who've not trained well, or rather they are following certain different patterns or compensating somewhere, they start to get injured, and then that becomes a little frustrating that they have started off well, they would never do 5, they could never do 10, and then once they start aiming for 21, they start to get injured, and this is where things needs to understand. So getting your analysis done and rectifying your problems and compensation beforehand will definitely help the efficiency better, and we can run pain-free.
Yeah, very well said, doctor, because you said rightly, after 10K, people tend to fall in love with running, and then if there is an injury, hearts are broken. So that is, that is an important problem to solve. Then, doctor, would gait analysis in itself help posture correction?
Yeah, it does. I mean, basically, partly it does, but posture analysis is a complete different entity altogether. So it comes right from your head to toe, as I said, and running posture is very different from a static posture, as I said. It is different from the walking posture. So you cannot have posture as such completely under one running gait. But yes, as you run properly, as you follow proper biomechanical corrective methods, your posture automatically is going to benefit in a way.
So when you give the when you do the gait analysis and the results are out, so along with that, will we have some idea of what maybe not entirely, but at least partial corrections to make?
Yeah, definitely. It is as I said, once you start correcting the biomechanics, automatically you see there are a lot of runners who run with their body lean forwards, So that obviously is not a good posture in a way. So once you start to correct them, you obviously correct their postures as well. So it's going to have a positive effect any which ways once we start to correct their running gait.
Yeah, makes sense. And then, Doctor, a lot of our runners, especially the ones who have been running for a while, and then they want to try different things, move from wearing shoes, expensive shoes, to barefoot.
Yeah.
So, does it make sense to do a gait analysis while they are going through this transition? This question is from Ashok Makija.
Okay, so basically it's a very good question again. So it is very important when you want to have a transition done. Firstly, you need to understand why you want to do it. If you're running comfortably, I don't want to kind of call it an expensive shoe running, but if you're running in a shoe comfortably without pain and you're achieving your goals, personal goals, I may say, not comparing with anybody else, uh, it is more important for you to continue doing that. But if you want to shift, then it has to be a gradual shift. It has to be done with some advice, and obviously gait analysis is going to help, because what we do in these cases is we make them run barefoot as well as with their running shoe. We do twice, and then we analyze both the gait running, the running gait simultaneously, and understand what is right for them. So this is also possible, that if you want to shift from shoe running to barefoot running, then we will be doing two running gait analysis simultaneously in the same session, and then we kind of identify what is going wrong where. So it can be done.
Yeah. So Doctor, just my follow-up question is: see, there are primarily two reasons why one would shift from shoes to barefoot. The first is to be able to run faster, and the second is, we keep hearing that humankind was meant to run naturally barefoot. So shoes are artificial. So these are the two aspects why we runners want to transition from shoes to barefoot. So what do you have to say about that?
Yeah, so basically there are two things. One, let me answer the first part. Obviously humans have not been wearing shoes since the mankind has kind of, but you should understand that evolution has happened. We are not used to having the same sort of our soles the way we probably had few hundred years ago. So it becomes very difficult, because we are not even used to walking barefoot on road for now, and getting back to running with that particular that is one part. So the evolution happens on, even on the cellular level, even on the skin, even on the tissues. So a lot of people cannot sit cross-legged, but if you see just about 2 generations back, people used to sit for hours sitting cross-legged on the floor. But like, there are so many people right now, you and I know, who cannot sit cross-legged. That doesn't mean that there's something wrong with the body, but it has been evolved. Every whole system, we don't sit on the floor nowadays. We use chairs, stools, and things like that. That doesn't mean we cannot go back there, but it needs, again, you need to retrain yourself. So this is where the gait analysis comes into picture, that if you want to train yourself again back to barefoot running, you have to go system wise. You need to understand that there's a thing that you need to follow. But yes, if they want to go back to barefoot running, as I said, it's completely different school of thought altogether. There are people who are trying it out, but as I said, to start off with, in my experience of whatever runners I see, they get back slowly towards barefoot running, and after a while they start getting injured again. So you need to be very careful when you do that.
And Doctor, one important question, probably the most important question going on in people's minds, is how much does this analysis cost?
So basically, as I said, this is the whole process. Let me put it the other way. I guess I don't know how many participants are here currently. Maybe whatever 70, 80.
Yeah, if we have 100.
So what I feel, costing, as I said, it costs about 4,000 rupees to do an analysis. But let me put it now that because this is a Pune running kind of an activity, if these 100 people they want to kind of, any of these 100 people who are attending today, let us give them some kind of a leverage of understanding the gait, because I'll need to explain them a little less when they come down to the clinic, and give them kind of let us make it, if they carry a code that you can kind of generate and give these people, let them come down until the end of August. I can get it done in 3,000 rupees if you're okay with it. I mean, that sounds fair to me. So
Fantastic. So what you're saying is that until the end of August for Pune running, special discount is 1,000 rupees. So instead of 4,000, we get 1,000 off. Is that right? And you'll do it for 3,000. Is that right, doctor?
absolutely, I can definitely say this on record. But
That's fantastic, and thank you so much for that.
most
There
of
are many more questions. So, so Suresh Pinnammaneni is asking, I'm suffering sometime back pain, and can I do running daily, or would you like? What's your suggestion?
again, we'll have to understand why there's a back pain and kind of get back to the again clinically evaluate why it is happening. Is it only during the run? Does it happen post run? How much does it stay for? And is there any previous history? Has the running pattern changed recently? So there are too many things. So it is difficult to understand answer this in like one go. But if you want to keep running, and you can manage with that little bit of niggle, you can continue. But if it increases, I think you should see somebody.
Okay. And Gajanan Tare has a similar problem. He has a similar question. He has heel pain and it aggravates after 10K. So is it related to gait?
It could be. If the heel pain is getting aggravated, obviously there could be reasons why. It could be tightness of his ankle tendons. It could be related to his hip joint as well. So it could be related to his back. So if it is happening post 10K, then we need to evaluate again clinically as to whether the joint ranges are better. Is he compensating on one particular thing? Is the tendon too tight or the Achilles, which is compensating somewhere and giving rise to that pain? So we just need to understand that, and then definitely we can help. For others, we can seek some expert advice, not a problem.
Okay, so Pooja Gavas has another question. Will gait analysis and correction help with fixing ITB and sciatic nerve irritation problems? And the question is, are there any specific correction methods for these issues?
Correct. So basically, if it is a repetitive IT band problem, which most of the runners do have, and it is kind of related to your gait most of the time. So obviously, it depends on your warm up and cool down and your strengthening exercises that you do. That is one part of it. But if it is a repetitive IT band problem, there could be some issues with your gait, and if it gets analyzed, we can correct them and then get back. As far as the sciatic nerve irritation go, again, that is a different issue altogether, which is not related to IT band, but obviously it could be related coming from the back and not necessarily, again, it could be sciatic irritation nerve only locally something is going wrong. Is it the muscle or is it the nerve that needs to be identified and we can rectify?
Okay. So you're saying it can be fixed, just that you would need to have a look at it.
Obviously, we'll need to have a look at it. It cannot be fixed just like that because, again, as I said, clinical evaluation becomes very necessary. You need to see some expert to identify the cause and then go about it.
So, doctor, the next question, not specific to gait, but still, someone with osteoporosis. So, is it advisable for such people to run?
Yes, I mean, depending, as I said, on the age, osteoporosis usually happens more in females after a certain age. And running, obviously, as I said, is not something that they should stop or not take up. But if they they're taking some supplementations, they're trying to build up the bone density by taking some supplements, they can definitely take up some sort of running. It's no harm in doing it. They should be, kind of be careful little by not having increasing their pain aggravation they should, kind of look at, and then with proper advice and gradually if they continue doing it, I don't see a problem why they should.
Okay. So you don't see a problem with it unless it is not severe.
Correct.
And then, doctor, this is Anirudh's question. Does sitting cross-legged create problem for the knees? Should runners avoid sitting cross-legged?
Not really. I cannot directly point out to that particular reason for this issue. You can start sitting cross-legged and runners not necessarily will have a problem, but you'll have to make sure that you condition your muscles and joints accordingly. You cannot just start sitting, do proper warm-up, proper stretching. You need to understand why you're doing it, and then you can go ahead and do it.
And if one is not used to it, probably sit for a little while and then maybe increase the duration of the time.
You just have to train for it. Even if you want to sit cross-legged, train for sitting for cross-legged, and you can definitely achieve it. It is not something that you shouldn't. But especially with senior citizens, I would want to kind of make them aware that yes, they have to be a little more careful because their joint surfaces are a little soft and eroded, and their muscle tissue is a little different. So if they sit cross-legged, it is not about sitting. Getting up from that position is something that they should be careful of. They can just kind of injure themselves. So they have to be careful. But otherwise, youngsters, I think they just train for it and you can continue.
Yeah, makes sense. Doctor, we all along we've been talking about runners and their problems. Mahesh, I can gather from his question, is a triathlete. So he's asking, will gait analysis help with swimming, cycling, or even other sports?
Other sports, I can definitely tell that it is going to help him. But with cycling and swimming, it is nothing to do. Running gait analysis is purely for making the biomechanics of running better. But it can be useful for some other running activities in other sports.
Okay.
As I said, there is a small positive aspect of getting the biomechanics right, because once you are doing something right, it is definitely going to be beneficial for something else as well, but not directly related to swimming or cycling.
Okay. And then I'll read out the question. Does gait analysis tell you only about kinematic linkage failure or other body part deteriorations? Are there any indications?
There are certain indications that I see. As I said in my talk, that the loading pattern of the joint, how the running pattern, in the sense, if you just kind of see, if you keep running, there is something in the pelvis that happens. You go up and down on one side. So these things are obviously analyzed, that how much is it responsible, what is the reference values that you can look at, and how much can you correct it. So these particular changes that we can identify during the run, during the analysis, are definitely corrected and they are helpful. So it does not necessarily mean that we just correct the run. It is definitely more important to understand that we correct the muscle imbalances, strengthen something that is weaker, release something which is tighter, and make sure that the analysis and make sure the biomechanics gets corrected automatically.
Okay. So, doctor, after this gait analysis is done, would there be any kind of changes that would be required in the footwear, and would you be talking about that as well?
Correct. So what happens, as I said, is the whole process of running gait analysis does involve something related to footwear as well. So it could be, as I said, depending on what the history of that particular runner is, whether they are barefoot, minimalistic, or running shoe related runner. Accordingly, we identify the problems and advise them. As far as I said, the analysis go, there are, after the report, the things go according to the problems that we find in that particular analysis. So it could be footwear, it could be, as I said, muscle imbalances, it could be something related to their cadence, it could be something related to their hip hiking, we call it. So these are all things that are considered when we give them solutions.
Makes sense, yes. Okay, Rahul K is asking, will running regularly after 60 or 70 age cause knee pain? In other words, running regularly now, will it cause knee pain after we turn 60 or 70?
Not really. There is not much of evidence that suggests that you're going to spoil your knees by running. There are 2-3 things, as I said. If you follow scientific pattern, if you understand what your goals are, if you go according to proper biomechanical corrections and keep running and keep increasing the mileage, again scientifically, I don't see a reason why you should land up with some knee problems after 60 or 70, provided there is no hereditary problems of arthritis or any other injuries. But otherwise, you can definitely continue doing your runs even at a later age, provided you do it very systematically.
Okay, that's fantastic. Lots of questions. I think we covered close to 50. Yeah, I think between 40 and 50 questions. Guys, are there any questions that I've missed? If I have, can you please type again? I'll give you a minute. So please type in the chat box if there are any questions that I've missed. I'll give you 1 minute.
It's already, oh, we're
We're just getting to the close, Doctor.
Yeah. Even shoot mails to the clinic ID, or they can call somebody who's got some specific issues. We can sort it out later. Not a problem.
Doctor, looks like we don't have any more questions. Over to you. Any closing comments before we hand it over to Sandeep?
I think it was a very wonderful session. Good, interesting questions from most of the runners. I think I've tried to answer them to their satisfaction. If not, I guess I'm open to getting any sort of suggestions or any other questions they have. I'm more than welcome to kind of shoot them directly to me. Yeah, thank you so much. I'll hand it over to
yeah, before we hand it over to Sandeep, people on the call, I'd request all of you to go to the reactions tab and show a thumbs up or a clap for Doctor, please. If you can do that.
Thank you so much. Thank you, Sudhi.
Yeah. Sandeep, over to you.
Yeah, thank you so much, Sudhi. As usual, Dr. Mapari, once again, thank you so much for being a source of support and guidance to Pune Running. And thank you so much for this insightful and informative session on running gait analysis. I'm sure this is going to help our running community to understand the biomechanics of running in a better manner and prevent injuries. Today's session was well attended. Unfortunately, we had a very limited number of seats available. So recorded this session, and for the benefit of those who have missed this session, we will shortly put up a link on YouTube, which everyone can view. I will also request our participants today to share in their views about what they would like to take us up in the next session, and we would be most happy to take up relevant topics which are of greatest concern to everyone. Once again, Dr. Mapari and the team, thank you so much for this effort. Thank you and happy running.
Thank you so much. Thank you. Enjoy, everyone. Be safe and